Hi everyone. Here in this lecture I am going to deal about the fetal skull, and it is an important topic for practical purpose of all the nursing courses. It is the most difficult part, whether it is to be delivered first or last, and it consisting of the cranial bones which forms vault, facial bones which forms face and the base part, and these cranial bones accommodate the important organ that is called brain inside it. So in this practical aspect I am going to deal about the various aspects of fetal skull, and these are the bones, sutures, fontanelles, areas and the diameters of fetal skull. So let's have a look on the fetal bone. Fetal bone consisting of two frontal bone, and these bones form forehead or sinciput, and at the center of these two consisting of ossification center and is termed as frontal eminence both side. Posterior or superior to that is two parietal bones, and at the center of these two parietal bones is the ossification center, it is the parietal eminence, and posterior which form the back of the skull is the occipital bone and the occipital region, and this occipital region consisting of one opening, and this opening is termed as foramen magnum, through which spinal cord runs and it connected by the brain. And on the either side or the lateral aspect there are two flat bones, and these are the temporal bones. So the bones are two frontal, two parietal bones, one occipital bone and two temporal bones. Then comes the suture, or sutures are the cranial joint where the two bones come closer, and the sutures are in between the two frontal bone is the frontal suture, and it is also known as metopic suture, and between the two frontal and the parietal bone is the coronal suture, and it lies at the farthest point of the temples. Then posterior to that is, which is lie between the two parietal bones, is sagittal or longitudinal suture, and posterior to that is one lambdoidal suture which lies between the occipital bone and the two parietal